New question, the member from Sarnia-Lambton.
Thank you, Mr. Speaker. My question is for the Minister of Health. Minister, as you will know, recently the Erie St. Clair Lynn, in my riding of Sarnia-Lambton, initiated a review of the emergency departments in its Lynn. This report was made public a few weeks ago, and the community of Petrolia and Sarnia-Lambton was shocked to learn that these consultants, after spending less than 2 whole hours in Petrolia, have recommended the downgrading of the emergency department of CEE Hospital in Petrolia to an urgent care ward. They have recommended this despite overwhelming evidence to the contrary, that the emergency department at CEE Hospital is an important part of the delivery of rural health care services in Lambton County. Minister, do you agree with taking away the emergency room designation at CEE Hospital? Thank you.
Sir.
I think it's important to remember that local health integration networks are tasked with local health planning, and that's why they commissioned the Hay Group to be able to look at all of the hospitals and what they should be able to do, to look ways to find and make the system work better for the community that it serves. I know, for example, that, as the member mentions, that the report was put out for a period of consultation to be able to talk to community residents. This is rather unique to members of the Conservative Party, in fact, who issued no consultation, did no work with local communities when it came time to configuring and to changing the healthcare system. Speaker, I was really encouraged when Chatham-Kent Mayor Randy Hope said, and I quote, "We need to remember that all we have so far is a consultant's report. No decision has been taken by the Health Integration Network. We have agreed the best way forward is to get all parties together and hold an informed decision." That's exactly what we're going to do.
Supplementary.
Minister, the Lynn that was appointed by your government has caused a health care crisis in central Lambton County. And I would urge the members of the government party that coming soon to a Lynn near you is a study that will affect your rural hospitals. No one in my community trusts the Lynn to make a fair and honest decision about CEE Hospital. Recently, 6 doctors in Petrolia have said they will resign their hospital privileges as of June 30th if they don't have a positive response, unless the Lynn agrees to keep the emergency department open. Minister, will you assure the people of central Lambton County that CEE Hospital will be able to keep its emergency room designation and not put health care in central Lambton in disrepute?
Well, Speaker, I think it's important to remember the fact that this is out for consultation, that there is, in the midst of it, I don't think it's incumbent to be able to presuppose what the results of those discussions are going to be. Speaker, I can tell you that it is, in my opinion, incumbent on all elected officials, community leaders, and partners in our healthcare system to focus on how best to engage the public during the process. Speaker, I think it's important to point out to the member that our government has, in fact, supported and will continue to support the Blue Water health system. Base funding, for example, for Blue Water Health has increased by $15 million since 2003. That's almost a 16% increase. And should the member and his colleagues be able to make the kind of changes to cut health care $3 billion in the province of Ontario, I shudder to think what the effect that would have, not only on Blue Water.